So let me thank everyone for taking time out of your day. This is make sure you're at the right location. This is the roundtable for Epic users at the National Association of Worksite Health Centers. We were asked by Jennifer at Grand Cheese to bring some people together. She's wants to raise some issues and questions, and then we would like to have others who have any questions or issues relating to their use of Epic in their on-site center, their site center, just kind of share that information. And we've got some colleagues here who are a little more expert in Epic, who can contribute and perhaps suggest some other things. But first, let's just go around the table and have everyone just introduce yourself and your organization and your role there. And I'll just do it based on how you show up on my screen. So Joanna, would you start out, please?
Sure. I'm Joanna Calloway. I'm an RN Epic certified in ambulatory working at Novant Health. And I'm currently supporting our corporate health, not as an Epic person, but as a nurse.
And you're located in Winston-Salem, North Carolina, right?
Yes, Winston-Salem.
Okay.
And we have affiliate centers in a few more states, but our other large centers are Charlotte, North Carolina, and the Winston-Salem market.
Great, thank you. Stephanie and Laura, would you introduce yourselves, please?
Yes, Stephanie Druin. I am the service line manager for Deaconess Clinic and also Deaconess Clinic at Work, which is our on-site and near-site program for employers. We are in Evansville, Indiana, primarily, but then we also have some outlying locations in Kentucky and outside of Evansville. And then Laura Epley is also joining me. She's our business support specialist and handles all of our data and analytics.
Great, thank you. Maria, introduce yourself, if you want.
Sure. Hi, my name is Maria Romano. I am with Premise Health. I am the Vice President of Health Equity and Medical Informatics. I am a nurse practitioner by trade, and I am a physician builder within Epic. And while the company is based out of Nashville, I'm actually here in beautiful Miami.
And I'll have to ask you at some point how they connected health equities and IT, but we'll leave that for another discussion. Justin, would you introduce yourself, please?
Yes, my name is Justin Tomberlin. I'm the owner of PHM Partners. We are a specialized consulting firm that deals with on-site and near-site clinics.
And you work with Epic as well?
Yes, I have clients that work with Epic.
Great, thank you. Jennifer, introduce yourself if you would.
Sure. So I'm Jennifer Conrad. I work here at Grande Cheese Company. I manage the benefits, health, and wellness for the company, and I manage our 7 on-site clinics. We currently partner with a hospital network, and they switched from Cerner to Epic in 2020, and we were having some struggles getting data. And so that's where Larry generously said he could do a roundtable so that we could kind of chat with all of you to get some info. So thank you.
Thank you. And where's Grand Cheese located for everyone?
So I am located in Wisconsin. All of our on-site clinics and manufacturing facilities are located here in Wisconsin. We have about 1,100 associates, and then in Wisconsin, and then about a sales force of about 50 across the United States.
Great, thanks very much. Cindy, would you introduce yourself?
Absolutely. I'm Cindy Whitehead. I'm the Senior Vice President of IT Applications and Data Integration. The data integrators and the build analysts and trainers for Epic roll up through me, and I am a partner with Maria.
Great, thank you. Diana, would you introduce yourself, please?
Sure, Diana Morrison. I am in Dallas. I help Larry Boris with all NAWHC related events and membership. So if y'all need anything, reach out to me.
Neil, would you introduce yourself, please?
Thank you, Larry. Diana, you open up a can of worms there. Hi, I'm Neil Camphouse. I am the System Director for On-Site Worksite Clinics and Centers for Bond Secure Mercy Health. We are actually Harness Health Partners, which is the direct-to-employer arm of the Bond Secure Mercy Health system. Have locations Ohio, Kentucky, Virginia, and South Carolina for our on-site services.
Great, thanks very much. Stacy, would you introduce yourself, please?
Sure, Stacy Krug. I'm with Gallagher, and I'm located in Iowa. work with Jennifer Conrad very closely. Aaron Bertle and I, as a team, work with Jennifer in regard to their benefits, entire benefit program, and then along with the on-site clinic. So we're just interested in mainly in regard to reporting and the ability of Epic to go and to actually generate information in regard to services in the clinic and all of that. So looking for the team's feedback in regard to those items.
Thank you. Aaron, would you introduce yourself, please?
Good afternoon, everyone. Thank you for allowing us to join today. My name is Aaron Bertle. I'm with Gallagher. I have worked in conjunction with the team to support Grande. Much of the work I've done for Grande over the last couple of years is relative to their pharmacy benefit as it relates to their overall healthcare. I've done a lot of reporting relative to the clinic that they operate and how it's working for employees with regard to prescriptions. So I'm very happy to be here today and learn from you all. Thank you.
Thank you. And Deanna, would you introduce yourself, please?
Sure, I'm Deanna. I'm a clinic manager for some on-site clinics in the greater Madison area.
Great, thank you very much. Oh, go ahead. Deanna, go ahead.
Yeah, I'm sorry, and we use Epic. So excited to
Okay.
learn from the group.
All right, so the way I'd like to run this discussion, I have Jennifer and her team talk about some of the questions and issues, and then really open it up for anybody to respond, or I can just call around each name, whatever is easier for you. That's how we've done Q&As on webinars in the past. But Jennifer, why don't you or Stacy or Aaron talk about some of your issues and what your questions are, what some of the challenges have been that you're looking for from the group.
Sure. I think one of the first questions really, probably more general is, what type of data are you getting back through Epic that your on-site clinics are administering?
Okay, so I'll go around. Stacy, Aaron, do you want to supplement that at all?
Yeah, as it relates to something that we've been looking at is when we have on-site clinic sending the lab values or reporting, if those lab values are a $0 cost, right, and they're sending them through a third-party administrator or some other service, are those then reportable through the third-party administrator? So from an end-to-end perspective, when those labs are created and pushed through to a third-party administrator, then, as it relates to comparing the values of those labs or what's been done versus the population as a whole. So that's where we're often asked to come in and say, okay, let's compare the value of the clinic to the overall healthcare operation, right? And that's where we have had a bit of a question mark or struggle as well.
And really utilizing the Epic system is the goal. Services rendered in the clinic in order to go into track population health, in order to go into track the progress in regard to the clinic. We're just looking to go into have more of a robust reporting system to go into, so we can go and actually make educated decisions in regard to how do we move the population to a healthier lifestyle. What tools do we go and we provide to them? So really the data is the main goal of this meeting, as far as what data are you putting in as a clinic? What data is coming out to go into track all of those metrics within the clinic? Was really the need is what we're in need of.
All right, well, let's start. Maria, do you want to make some general comments on that? Take yourself off mute.
Yeah. Yeah, sorry, I'm struggling with this phone. I don't normally do Zoom on this phone. I think that there's so much data that we do collect at the health center. I feel like, and I don't want to put you on the spot, Cindy, but this is more of a CAD question, I think, than really something that I would be answering, because at the site level, how we use the data is probably very similar to how other Epic users are using it.
Well, Cindy, what do you think?
And I have to preface this, that our model is very different. So we have been a challenge to Epic. We're a B2B2C, so not a B2C. And our reporting requirements and performance guarantees that we commit to with our customers have us take a lot of this outside of Epic and use Click to do some of the work. Having said that, we're kicking off a project to reevaluate how we use Healthy Planet and Compass Rose and some of the tools to see how much of that we can internalize to Epic. When we first went live on Epic, which has been a little over 5 years now, we were a challenge to Epic because of the B2B2C. We're the first client they had that was B2B2C. So our facility structures would look different than you guys. The way we're integrated with labs, because we do client by client instead of clinic by clinic. And we have some state contracts that require us to use their labs. It's just really different. We have used Click outside of, we've been exporting data and using the Chronicles database for our Click reporting for more of our ROI. That's what I think you're talking about more than anything else is ROI. And we are working over the next 6 months to a year to get that back into Epic as much as we can. But that is just now kicking off. We've got to buy some tools. Part of what Maria works on is social determinants of health and the tools that we're implementing. And that's really important to us as an organization, obviously, because we have the vice president of it. But the tools that we're implementing to help us with that, help us with the other work lists and how we bring values to our clients is Compass Rose. And we are just now getting ready to purchase that and deploy it.
Thank you. Joanna, you want to comment on this?
Well, I guess I worked at Cedar Sinai before Novant Health, and when we first went live there, it was a struggle to have our data uploaded into Epic. It did not import well at all. So lesson learned was we needed to abstract a lot of data that was necessary for our providers to continue care seamlessly. So the best thing I've been experienced to is having quick abstraction for the bare necessities in one's chart.
Thank you. Stephanie, your thoughts and comments with Laura?
Sure. So my input's probably going to be a little bit more from the operational level rather than, the IT side of things. But I know we've got kind of two different branches here. We've got reporting that we give to our employers, that work with our on-site and near sites on a monthly basis, and that information is reported directly out of Epic, and that's things like utilization information, things about volumes of different types of medications and labs that were covered under the program or under the formulary, things like that. And so you can make some soft assumptions about cost savings with that type of information, about how much they're using the clinic and things like that. But then we also work with our IT team to export a lot of information about the services that we do. With our particular model, for the services that we perform, they don't generate claims data. And so we struggle with a gap, in the information for the TPA because of that. And so then Epic will export, encounter level data, labs, medications, things like that, to like a third party data analytics vendor of the employer's choice or of the TPA's choice, so that they can then fill in those gaps and make some assumptions for them.
Thank you. Justin, your thoughts?
I don't have any additional thoughts other than, we work with a lot of different vendors and partners, I guess, and a lot of different employers. And I'm just interested to see how others are using Epic or for the reporting to report back to employers.
Well, how are you guys using it?
Well, we work with the vendor partner, and the vendor partner really uses Epic. I'm the consultant that's involved with that vendor partner, but understanding the capabilities of what to ask for is definitely crucial. Like previously mentioned, sometimes we can get data out of the electronic health record itself. Other times we need to work with the TPA. But how do we get to the data we need so that we can show a picture of outcomes of the ROI involved in the clinic offering?
Okay. Neil, your thoughts?
Yeah, thanks, Larry. Very similar, probably comments and thoughts. We're part of a health system. So some of the issues and dilemmas we have run into with our on-site platforms, really partnering with data analytics and having a dedicated team to help us extract some of that data. Harness Health, at one point, we had some data analytic folks that were part of our team. We're in a total transition, just to be totally transparent. So we're working with some data analytics to help us extract some data. Typically, we've been able to pull some data out of Epic, to show ROI and counters, types of visits, length of visits, that kind of stuff, using Clarity and Tableau to kind of dump things into. We have blended models where we also have Ahmed EMR. So it's a struggle because sometimes we can pull some data out of our Ahmed platform very simply and easily and really struggle with our Epic data. The other issue, just we have a lot of issues with the billing side of it. Direct to employer billing is difficult, at least on our side of the fence with Epic. I don't know if others experience that, but we really have had some complexities due to sitting inside in the healthcare system. It's been difficult, developing unique NPIs and zero encounters and those kinds of things. So,
gotcha. Thank you, Deanna. Your thoughts?
Yeah, thanks. We report out of Epic, similar to, apologies, I can't remember who brought up these points, but like utilization, volumes, visit types, referrals, and then we also extract the CPT code level data and run that against, and then use our IT analysts to run that against a fee schedule, like a payer fee schedule, and to report out on the ROI piece of it. And I would agree with Neil. The billing is less than ideal. In most of my clinics, we don't drop claims at all. But setting up those $0 claims is not best, and Ag Health billing is even worse out of Epic. So,
Deanna, do you submit $0 claims then for your employers to the plan?
we do not in most of my clinics. No, in some, yes, we do.
And is that the employer choice, or is that a system issue? What is it?
Employer choice.
And when you do that for employers, does a plan then give you or give the employer then a broader view of how the center compares to the outside community?
We work with the brokers typically or the consultants to get the data on the overall population health of the entire population of what we're serving. And then we compare that against the data that we can pull out of Epic based off the people who have visited here, if that makes sense. Does that answer your question?
Sure. Jennifer, do you want any follow-ups on that, or Stacy or Aaron?
Hey, Larry, this is Neil. I don't know if this is a appropriate question to ask, but Deanna, your point is well taken, and we deal and suffer with this all the time. So, we are able to develop what we call unique MPI numbers, so it can either drop a zero claim or it doesn't get billed to the client and or the insurer. But what we notice so many times is Epic goes through all these revisions, upgrades, et cetera, and all those rules that you put in for it not to do what you didn't want it to do don't transition over. We struggle with that so much. So the rule that you put in with the unique MPI, or don't drop a claim, or do drop a claim, $0 claim, gets changed almost all the time when Epic goes through an upgrade.
Yes, I do have one clinic where we do have that unique NPI, and it is problematic. I don't disagree with you there. I prefer in my other clinics where we don't drop claims and we're built in sort of this Epic void, where we're sort of protected from some of those changes, and that's helpful.
I'm sorry. So Jennifer, or Aaron, go ahead.
Yeah, I had a question relative to that. So this is two parts. One part would be, is the issue with submitting a claim that it is a $0 value, or is it an issue with I'm not tracking on the MPI connectivity on that. Is it because it's a zero cost that makes it a challenge within Epic?
Aaron, I'm not sure if I'm going to address your question specifically, but what our Epic build team has us do is they develop them, but they want unique MPIs created so it does not drop a dollar claim to the employer or to the payer. Does that make sense?
So as opposed to dropping a zero, so
Correct.
you do not want to record the claim transaction at all in essence of that case.
Correct.
So that's part of the problem.
Yes.
Okay.
Cindy, is that how Premise does it as well?
We drop claims, however, ours is so rule-based that, because the TPA and the client drives it, sometimes they're what we call shadow claims. We call it a circle of
Right.
money, and sometimes they're $0, but we don't. When we went from our other 5 EMRs to Epic, we simplified that as much as we could and gave options to our employers and their TPAs. However, we still deviate from that and have rules we have to maintain.
Joanna, do you guys submit $0 claims?
I know, working in corporate health, what we have for occupational med is we have outside of the organization clients, like for Joe Gibbs Racing or the Charlotte Hornets. And then we build the company, and the template is set up so that there's no charges going to the individual.
Ours is a little unique in our B2B to C model in that every one of our clients can have a fee schedule that has certain services covered and certain not. So we have to build that on a client by client basis. So if they have an agreement that says labs attached to an office visit are covered, but labs on a standalone lab or not, we have to build to that. And then there are billing, like I said, rules built around all of that, but that is on a client by client. I would call it somewhat rocket science, and we have a wonderful RCM team that manages that. The builders may be on my team, but it's the RCM team that interprets that for us.
All right, Jennifer, want to do any follow-up questions on that?
I guess one question I would have is from your on-site clinics, how long have you all used Epic for any data and reporting, tracking?
All right, Stephanie, how long have you guys used Epic?
We've had Epic at our facility since 2008, but as far as for our employer clinics, that was 2018.
Okay, just Premise, you said you were using them for about 5 years now?
5 years.
5 years.
Yes.
Yeah.
We had a
Neil?
really aggressive rollout of about 400 health centers in 18 months.
Yeah. Neil, how long have you had it?
Yeah, we'd be in that same time frame, Larry, 4 to 5 years.
4 to 5 years. Deanna, how about you?
10.
10 years. Okay. And Joanna, how long there?
Since 2012
Okay.
at Novant.
Let me ask you all, and does Epic have a specialist that work just with employer centers, or is it just whoever your account rep is, so that's who you have to deal with? What do you find?
Just
I
to-
think, sorry.
I'm sorry. Go ahead, Joanne.
Epic, when we started that on the West Coast, they were quite elbow support for everything there. We could ask for things and it would magically happen. Of course, that's different on the East Coast. And so we have support. We have a good relationship with our Epic people on our, I guess, our ambulatory side. We have a person that we reach out to help with reports. Many of our analysts that are certified with building and report writing are able to critique the reports or customize reports that we want on a monthly basis. Like, for instance, we're now collecting data for like biometric data, panel metrics. We also are measuring in-basket. So the providers are being tasked to keep their in-basket tidy, so there's nothing missed or there's no gaps in care.
Others' experiences?
Excuse me?
So I was just wondering others' experiences with Epic as far as whether they have people who either specialize or really help out a lot with the employer side.
No, not specific to that. We had an education process that we called our project the Imagine Project. And we had to educate them on actually in employer-sponsored workspaces and how our B2B2C works. What they have done, though, is they've stayed with us aside from our My Chart analyst. We have a technical support analyst from Epic assigned to each module that we've deployed. So we have a My Chart TS, a Healthy Planet TS, ambulatory TS, Resolute TS. For all of those, we have someone that stays with us and understand on top of our BFF and our, I can't remember what our, he's a technical support person that is more overarching and understands Epic and our business model and helps us with that. They've been great partners with us.
Okay. So do you think it would be valuable for NAWHC to connect with Epic and try to develop certain kinds of relationships or rules or communications, or would that just get in the way of your individual activities? What do you prefer? Neil, what do you think? Neil? There you go.
Yeah, I'm sorry, I was muted. Can you repeat? I'm sorry, I was reading an email, so quick.
Sorry about that. Yeah, I know it's tough on Zoom. You can't avoid those emails. I just got a phone call as well.
Yeah.
The question I had was, like when I was head of Midwest Business Group on Health, we had health plan user groups, and we'd have a Blues group and an Aetna group and a United group. And what we found is while everybody had their own account manager, to really get to senior management or to get some real answers, it helped to have a relationship with the entity, with our coalition, and then have everyone participate. And I'm wondering, does it make sense for us to do that with Epic here? That we have an organization that everybody would come to, say, a session, a user group session, say, and get the right people from Epic to talk? Or is Epic just so dispersed, and would it just interfere with or confuse what you guys are all doing here? Joanna, what's your thought about that?
I think it's benefit to having some Epic analysis. They could start with a remote or virtual kind of analysis, depending on what kind of results you want. I'm not sure how robust your builders are with reporting, but Epic has wonderful reports that can pull a lot of data. The problem is if people do free text and don't use the fields correctly, they're not going to get the answers. So the reporting is only as good as the data that's properly placed into Epic.
Yeah.
Neil, go ahead.
No, I agree. It's always going to be as good as what's put in. No, Larry, I mean, to your question specifically, I think there would be a tremendous amount of value for that. I think getting everybody to be working off of the same language and using the same data the way that it needs to be reported and managed is a difficult process from time to time. But I think it would be a value to bring those entities together.
Cindy, what do you think? It would be valuable to have some consistency? I mean, every company is going to have it separately required, as you've mentioned at the start. But are there some overall areas that you think we could improve if we work with them as a total organization as opposed to the individuals? Would it help or would it cause issues? What do you think?
I think it helped, but if you see me giggling a little bit, Maria and I have been through this. I think one of the things we all recognize when we sign on with Epic is Epic does what Epic wants to do. There's not a lot of pressure you can put on Epic. They know who they are in the space and they don't deviate from their roadmap or plan often. Maria has been on a couple of their advisory boards. She's been on their Oc Health advisory board, which was inspired by getting more employer clients. And she's on the you're on the SDOH board now, aren't you, Marina?
I actually wanted to speak to that. So to your point, Cindy, that's exactly what happened. So sitting on the SDOH advisory board with Epic, there are several healthcare systems that are represented on that board. And you can see that the needs are so vastly different. And so it's a challenge, even though we're all in healthcare, to get what we want. So I'm just not, I don't know that I'm sold that we would get value out of spending time with them because the needs are just different.
Mhm. Jennifer, what do you think?
Yeah, I could see from a person who's not in healthcare, right? From an HR perspective, I could see the value of connecting with them to really understand what is it that they provide, that they can provide, right? Through data and reports, dashboards, because otherwise from our perspective, we're often taking it from the vendor that we're partnering with, whether they can do it or can't do it, how much work it is without really even understanding or knowing what is the capability of what could come from them. So I do see some value from it.
Stacy, what do you think?
I agree. I mean, not being in the, front lines healthcare, it's just a matter of for us to know the ability, what that system can generate. How can we go and how can we work through and provide those key tools to, our groups in regard to on-site clinics, what they have. I think that's really, helpful for an on-site clinic.
Deanna, what do you think?
Yeah, I think it would be beneficial. I agree with Maria and Cindy. I don't know how easily, how much value we could get out of it, but certainly learning, the different capabilities. I think also sometimes there's differences in the Epic version that we all have. And so it's not necessarily one size fits all, but I would be very interested in participating in a relationship with them for sure.
Okay. I'll go back to you, Neil. What did you think about that?
Yeah, I think I agree with Dan. There are so many different versions and so many different complexities to it. I struggle with it. And Stacy, maybe you and Aaron can respond to this. I mean, we talk with other brokers that have relationships with our on-site clinics, and the comments are pretty transparent. Your competitors can do this stuff. Why can't you do this stuff? Is Epic your problem? And I really struggle with us being able to get the data's there, and we just have a heck of a time getting it out consistently and automated to be useful to the brokers and the payers. That's just one of our big struggles.
Justin, what do you think about that?
Well, I think it's a great idea, actually. I've had the pleasure over the last 13 or so years to work with about 100 different employers in this area and many different vendor partners that are sponsoring these. And it blows my mind that they don't pay attention to groups like Premise, who have so many clients that are doing this. But I think your association and getting employers together and to say, hey, these are all the people that are interested, and here's some of the logos of the employers we represent, I think it might get them to pay a little bit more attention to our needs. Because as health systems, and I have several clients that are health systems as well, they are very different in their needs. But frankly, in the employer-sponsored clinic space, we share a lot in common with what we need to get out of an EMR.
I agree. Stephanie, your
One
thoughts?
way you could frame it up is because they are developing an Oc Health module. And to do that in a vacuum, which has been Maria's challenge all along, without getting input from people who actually manage Oc Health clinics, it has not gone at the pace, or they have not released at the features that would be most important to us to be able to deploy that as a single system and a single database. So they're showing interest in employer-sponsored health because they're developing an off-health module. However, it's not getting there quickly.
Okay, again, Stephanie, Laura, your comments there?
Yeah, I mean, I don't know that I have a ton to add to that. I definitely echo what everyone has said as far as thinking that it would be very valuable, you know, from the, you know, provider of the service standpoint. I mean, I think that we are always looking for ways to generate additional information for these clients of ours, and sometimes it's just, you know, you don't know what you don't know, and so any traction that we can get to help with that would be extremely helpful. And Cindy, I agree with you that I sure wish that the pace would quicken, you know, with that OC Health module.
Yeah. All right, so let's again go around, see
We've
if people
been-
have other. Go ahead, Maria.
I'm sorry, I was just going to say, we've been talking about it for 5 years. So just to give you an idea of, you know, the length of time that it takes, and we're still not even close to where we need to be.
Yeah,
I hear you.
that's critical. I agree.
Yeah, and as I mentioned earlier, when I used to run a Blue Cross Blue Shield user group in Illinois, and they were the largest plan in the state. And when they used to say, you know, we know the right way to do it. You don't have to tell us. But once we brought together millions of dollars in premiums represented by these employers and millions of lives, they changed what they did. They were much more responsive. And it particularly helped companies that were not the jumbo employers, but even the smaller ones. And I think there's value in combining and consolidating, even though everybody's got their own situation. So you know, just to kind of conclude this, let's again go around and see if anybody has other kinds of questions you'd like input from people here. And frankly, Maria and Cindy, anything you'd have questions of the other people outside of premise that you'd like to get their thoughts on?
No, we have a really good relationship again with our BFF and the people. If we have issues that we can't resolve or challenges that a new employer may bring, we get powwows with the people at Epic. Our leaders are assigned to us at Epic, and we're generally very heard. I think the only place we aren't is on the OC Health side. Other than that, we've had really good experience in bringing them into our challenges and then partnering with us on solutions.
All right. Well, it would be helpful for me if you could perhaps share with me the contacts or who you think I should contact to pursue this thought as well. I don't know, Aaron, any other questions you'd have for the group?
I did have a question, and again, this may be too much down a rabbit hole, but in some of the reporting that we've seen, it's relative to grouping Epic utilizers by a geographic region. So I think we happen to be in the Midwest mean is what they reference. So I'd be curious to understand if other clinic utilizers or Epic utilizers with clinics are looking at that data, and is it relative to anything that you report back to the employer? So some of the geographic reporting, because to me it's very broad, right? To look at a region may or may not have material value to that particular client, and that's been my assessment. And again, this is me coming into this a little bit from the outside.
Joanna, your thoughts on that?
Well, I know that the reporting that we have recently set up for our, like, we're doing for occupational, we're doing the blood pressure, the BMI, and we're doing the 5 ranges of blood pressure. But Epic just puts a systolic and a diastolic. So you still have to do some manual configuring of your report so that they will fit in the correct columns. And so I'm tasked with doing that, which I like doing, but I think if I knew more about the reporting, I could probably customize it a bit better.
Neil, your thoughts on the question?
We really don't break it down there in that way, geographically or demographically. We had done the same thing.
Eddie, come here.
Welcome to the
Joanne,
remote world, right?
That was good, yeah.
I
We've
muted
done the
him for
same
now.
thing with customizing so much of the biometric data, Aaron, that I don't know if that was Joanna that said that, but we've actually had to, customize reporting, dump it into Excel and reformat.
Lab values, those types
Yeah.
of things. Yeah, so that you're customizing to what the particular client is asking relative to their need. Or okay,
Exactly.
yeah. I'm sure Larry wouldn't mind if I just asked additional follow-up questions. So then, is there anyone on the group that's using a geographic mean that's available, evidently from what we understand to be reporting unique to Epic?
Aaron,
Grouping utilizers together.
I'm gonna jump in and just see, because I know exactly what you're talking about. Does anybody else use the dashboards for the population health metrics? And if so, what are those? What's the comparison that is being used on those dashboards?
The comparators, exactly where I'm thinking, Deanna. Yes.
Mhm.
Not in the way you guys are describing. Ours are all based on, our reporting is based on performance guarantees and ROI.
Okay. Neil, do you use those population health dashboards at all in Epic?
We are not, Deanna, no.
I'm back.
Larry, at Premise, we have a rule, and Maria will back me up on this, that if your dog barks or your baby cries, you have to put them on screen.
Eddie, Eddie, come here. Eddie.
A double bonus if you have a baby and a dog.
Come
You
here.
get double points for that, Aaron. You
Come
do.
here.
You've hit the
All right.
you've hit the Midwest mean then if you have both a dog and a baby.
Ah,
It's amazing.
Okay.
Thank you for
There.
sharing. Oh, look at that face.
Yeah, that's cute. That's a cute
You did
thing.
your job well, buddy.
yeah, he does fine.
Go.
Okay, go play.
A dog's life.
You all can
Sorry,
talk to
sorry. All right, Cindy, I'll keep that in mind. We'll have to add that on. All right, well, I hope everyone found that there's something. Oh, Jennifer, go ahead. Please.
Yeah, I have one other question. Just wondering if anyone would be willing to share the types of KPIs that they use with their on-site clinic, or an example of the dashboards that they use with their clinics, looking for ideas of what we should continue to share up with our executive group, with our C-suite, to be able to help them understand what's happening within the clinic. So if anybody would be willing to share.
Well, I'll tell you, if you'll send it to me, I'll send it to everybody who's on the call. So if you could share either dashboards or reports to senior management or whatever reporting would be helpful, that'd be great. Nothing that's proprietary, just have fake information in there, but that would be helpful. And I'll just share it with those people on the call. We won't publish this unnecessarily unless you're comfortable with that. By the way, I'm recording this discussion, and I will have it available. I'll send it all to you so you guys can follow up if you want later on. But that's fine. But I thank you all for participating in this. Maria and particularly Cindy. Maria, struggling through. We'll send you some gas here from Phoenix, though. I got to tell you, the gas here in Phoenix is more than California. It's like almost $5 a gallon now. Used to be so much cheaper. But
I'll take it at 5. I'll take it at 10 at this point. If I don't have to wait in line, send it on down.
All right. Well, thank you all very much, Jennifer. I hope you found this worthwhile. Thank you, Aaron and Stacy, for being part of Neil and Joanna.
Thank you. Thank you very much.
Everybody else. Take care, guys. Have a good week.
Everyone, thank
Yeah.
you. Have a great day.
Bye-bye.